Most of us like happy surprises. No one likes nasty ones. My name is Keith Neely. For 7 years, I have been fighting with television executives to produce a documentary about a critically important topic, but they refuse. So I did it without them, and I'm bringing it directly to you. I used to think that abortion was a safe, fast, and easy way to end a pregnancy, but I learned that there are many nasty and permanent surprises that occur. Our physician must apprise us before we agree to any operation so that we can decide if it is worth the risks.
So you can't just pat the patient on the head and say, don't you worry about it, everything will be all right. If you do that, and in actual fact you should have told them something else, then you haven't got an informed consent, and then you're going to be liable, medical malpractice liability, for failing to get an informed consent.
Physicians are in a difficult position as their patients ask them to refer for an abortion. Although it was legalized for the health benefit of women, medical research clearly demonstrates that it is not the safe and healthy choice the public thinks it is. In fact, the health risks associated with abortion have been known for decades and have been validated as accurate in the courtroom by judges and juries. These risks are not the myths and lies the media claim. And even if a risk is not generally accepted by the medical profession, legally, a physician must still present it to their patient. Hundreds of studies about abortion risks have been done, but of course a single study can prove anything. The cigarette industry hid behind such studies for years. What really counts are meta-studies. No meta-study has cleared abortion as a relatively safe procedure, but 7 have documented its serious health risks. The most recent one was published May 2016 by the American Journal of Obstetrics and Gynecology. That's 7-0 against abortion. No one can claim this is a low-risk procedure because in the United States there is no trustworthy data. The Federal Bureau of Vital Statistics National Death Certificate Form does not include abortion. The Center for Disease Control receives only voluntary submission of statistics from each state. California doesn't even bother submitting data to the CDC. After an abortion, the clinic tells its clients to go to the hospital if there is a problem. There, the emergency room physician will get paid more if he or she codes it, for example, treatment for septic shock rather than an abortion problem. Indeed, the ER physician might not get paid at all if he codes the emergency as a complication of an abortion. To determine what the health risks of the procedure really are, we have to look to other countries where medical records are centralized and dependable. When we do that, the mantra, abortion is safer than childbirth, is proven to be absolutely false.
And so on the outside, it looks like abortions are safer than childbirth. The reality is, if you look at the long-term complications of induced abortions, and you start looking at the self-abuse rates which lead to addictions, which lead to suicide, and you take into account the number of people who've had an induced abortion, who did not have a mental health problem beforehand, who develop a mental health problem, and then go on to suicide or become involved in a violent death, which is accidental, or a violent death, i.e. a homicide, that's much higher than the general population, increases by about 6-fold. So take those deaths into account, there's no way that abortion is safer than childbirth.
One last thought for physicians. Your malpractice insurance likely excludes an act of the will. Just when you need it, could your insurer invoke that exclusion clause if you disregard these clearly established risks of abortion? For everyone's benefit, please invest about 12 minutes more to watch this documentary excerpt.
Abortion is the most common outpatient surgical procedure in the country. And abortion is 11 times safer than carrying.
Same thing that said over there.
Nearly twice as safe as a penicillin injection. The procedure takes 2 to 3 minutes.
So the quick fix isn't a fix at all. It's just a temporary thing that's going to cause a lot more pain after.
Abortion is not a benign procedure since there are so many risks for it.
Abortion is not an easy, quick fix. For many women, it results in a lifetime of suffering. I've been involved in lawsuits where women have committed suicide or experienced significant psychological problems after an abortion. And so it's not the easy fix that society will tell you it is.
It's very politically incorrect to say anything negative about abortion. even if it's medically true. And that creates a lot of injustice to women, because women deserve to know the truth. Women deserve to know how their bodies change during pregnancy and the impact of their choices.
But there is no evidence there are no scientific studies showing benefits, psychological or otherwise, to women. Yet we have laws that are based on that. And at the same time, we have hundreds of studies showing negative effects.
If you look at the data quite closely, you look at the incidence of preterm birth is less if you have a baby and go to term versus having an abortion. And the psychological benefits, less suicides and less mental health problems if you have babies versus abortions. So there's lots of health benefits to having your baby at term, particularly at a younger age, before age 30 in particular.
The last area that was litigated was the suicide disclosure. So our lawyers presented information, and the Planned Parenthood presented information, all from the science, and then the judges looked at it all and ruled that yes, there is an increased risk of suicide associated with abortion. So had very smart, educated judges looking at the information that was derived from the scientific literature and came down on the side of yes, that there are risks to women that they deserve to be told about.
My friends and I were researching online the matter of abortion risks. We noticed an incredible gap between what is being claimed by those who dismiss or minimize the risks of abortion and those who have great concerns about it.
Possible complications.
Oh,
okay. Infection, 0.5%. Incomplete abortion, less than 1%. Damage to the uterus, 1%. Cervical tear, 0.5%.
Many women have multiple risk factors operating at the same time, but the point is that when you put them all together, it's likely to be a large number, like 70 or 80%, who walk into a facility have one or more risk factors operative in their lives. And so when we talk about counseling women who are at risk, we're not talking about a small number of women. The majority of women who walk into an abortion provider are at risk for having adverse reactions.
those who have very deep concerns say there's over 500 studies about these risks. Enough file folders to fill these 5 boxes. The studies have included millions of women across numerous countries. Those who provide the abortion services suggest that these risks are minimal or non-existent. We are going to present the evidence and let you decide.
To summarize the effect in terms of the immediate consequences of an induced abortion, we see in Canada about a 5% rate of return to emerge or to the doctor's office directly attributable to hemorrhaging. Of these, half of these women need to go back to the OR.
Hemorrhaging is a risk. It is important that we understand what actually happens in an abortion. During a surgical abortion, the fetus is taken from the uterus after gently, although physically, forcing open the cervix with a surgical instrument. Sometimes, this damages a cervix muscle, just like a sports injury can permanently damage muscles. The consequence, if that happens, is unknown until in the future, when you want to carry a baby for 9 months. Your cervix muscle is too weak and the child is born prematurely. That is a big problem.
Well, the problems in pregnancy that I deal with all the time as a high-risk obstetrician are the preterm birth risks. And of course, the preterm birth is a delivery before 37, but most of them, 37 weeks, most of them before 34 weeks, but abortion is particularly damaging and causes the really, really early preterm deliveries below 28 weeks. And those are the babies who are at risk for cerebral palsy, the risk for autism, the risk for developmental delays.
And there's no question that women who have abortions are far more likely to have a premature baby because most of the womb's been tampered with and it's more sensitive. So that makes sense scientifically.
Risk increases and escalates if you've had more than one abortion. So 2 or more abortions, that risk of having premature delivery, very low birth weight baby goes up by 2.5 times.
Below 26 weeks, probably less than half of the babies survive, and certainly below 24 weeks. And anybody below 28 weeks is very high risk to develop increased risk for cerebral palsy, the autism spectrum disorders, and the hearing loss, visual loss, all the things that go along with extreme prematurity.
The parents would be often not even aware of the fact that there would be a link between their premature infant and something that the mother chose to do 10, 12 years before that.
If you look at a baby born at, say, 28 weeks or below in my country, it's about $250,000 to $300,000 just for hospital. Now that does not include the possibility of special schools, of going through therapy, of all the interventions that are going to need to be done for that child. So it may be a $500,000 to several $1 million experience for the public and or for that family.
We looked at those families. There was a study which was done in the pediatric literature. Over 85% of those families break up within 5 years of those children being born. So the cost is great.
Not to mention all the time and all the increased stress and all the increased care that's required for a child who has some special needs. And I have a special needs child, so I know quite a bit about that. So it's a significant amount of effort for everyone, and particularly for a young mom who's maybe single. That's a really tough row to hoe, as we say.
An induced abortion could either be a surgically induced abortion or a medically induced abortion. With a medically induced abortion, we give the woman 2 different types of medication, which basically kills the baby and puts the mother into labor. With a surgically induced abortion, what we do is we dilate up the cervix, and then we go in with a suction catheter and suck out the contents of the uterus, which would include, of course, the fetus and the placenta and the amniotic membranes. In terms of delayed consequences, there's also the very, very real problem of follow-up subfertility, infertility, or problems with pregnancies. And as a family doctor, we might see that coming into the office because somebody comes in who wants to become pregnant, and in their distant past history they've had an abortion, and it needs to be considered. The people who see those most often are the infertility clinics.
Miss, what should you believe? I won't be able to get pregnant after an abortion. An abortion performed by an experienced physician under sterile conditions does not hamper a woman's future fertility.
There's also evidence to support that multiple surgical procedures scars the uterus down, much as you would scar any other part of your body, and those wombs or uteruses are unable to support a pregnancy because of the scarring that's been done as a result of the multiple surgical procedures.
I found out in my 20s when I was trying to get pregnant that I couldn't get pregnant, and I was blaming my fiance, he was blaming me, and so we both went to a doctor to get checked out, and it came back that I was the one that had scar tissue on the inside of my uterus, and I had about a 17% chance of getting pregnant.
If an abortion uses the chemical process instead of the surgical instrument, there is a very small but serious risk of reaction to these chemicals. Keep in mind, these chemicals must be strong enough to accomplish their intended purpose. Our body's natural immunity is what helps us fight infection. Sepsis is a serious medical condition in which your whole body, instead of just a finger or a foot, is infected.
And that they postulate, and nobody's actually proven it, is because the medications changes our immunity. And that's why a couple of the women who've had post-abortal PID caused by following a medically induced abortion have actually died from overwhelming sepsis because of this change in your humoral immunity.
Another risk is a problem called PID. That's short for pelvic inflammatory disease, which is an infection. Fortunately, pelvic inflammatory disease doesn't have to happen. You can take antibiotics for it.
So the antibiotics work, but the problem is that when they're given to people, prescription is given to somebody who doesn't have a drug plan. If they're not sick, they won't fill it.
Having PID is a risk that can lead to a very serious complication called ectopic pregnancy.
Very serious. In fact, one of the leading causes of death even to this day are unrecognized tubal pregnancies in young women.
I didn't know what it was. I thought maybe it was cancer because it felt like it was growing inside me, and I had never heard of anything, I'd never heard of an ectopic pregnancy. In the end, the ectopic pregnancy ruptured, and I was rushed back to the hospital. I was bleeding profusely. I underwent emergency surgery, and my life was saved.
The newer studies consistently showed no association between induced and spontaneous abortions and breast cancer risk.
So clearly the epidemiologic studies in the last over 50 years have always supported an abortion breast cancer link.
You develop the breasts much more densely with immature breast tissue, and that increases your exposure for possible increased risk of breast cancer, and that's an independent risk with abortion, not just delaying pregnancy, which is actually, we've known that for many, many years. Several hundred years actually, that people that didn't get pregnant, like nuns or people who didn't have babies, had breast cancer, higher risk. I think the problem is that it's become so politicized and so polarizing that people are afraid to engage the data truthfully and accurately.
I think if she's somebody that has a family history, she's at much higher risk. If she's in the second trimester, there was one study that showed teenagers who have abortions between 9 and 24 weeks have about an 800% increased risk of breast cancer.
My sister died at the age of 50 from cancer. My mother had 2 bouts with breast cancer, one in her 40s, one in her 50s, had a double mastectomy, and died of cancer on my birthday this past year. And so I wonder what the future, holds for me.
So it's critically important to a young woman to help her understand that if she undergoes an elective abortion, that she's increased her risk for breast cancer. You need to tell her that. She's increased her risk for preterm delivery. She needs to know that. She's increased her risk for possible mortality and mental health issues. They need to know all of those things, and they need to understand what that means in their life going forward.
Those are just medical facts that need to be presented so that a woman can have an informed consent. Otherwise, she doesn't have informed consent.